Hello, and you're very welcome along to the Unpopular Opinion podcast. My name is Jen.
And I'm Carla.
And this week we are rejoined, very delighted and happy and excited to be rejoined by I'll give his Instagram handle, and obviously I'll link it in the description below. Cognitive_Conal for all your therapeutic needs. We're already been talking before we pressed record to
beat the band, unfortunately.
To beat the band, and I think we've actually talked about absolutely everything. I was like, why the fuck aren't we recording this? So Conal, please introduce yourself, what you're about, just as a refresher for people who have listened to the last time, because there's been a few changes since we were here the last time as well, which we need to talk about.
Yeah, there is. So first of all, thanks very much for having me on. So I am the director of CBT Solutions in Castleknock. We are a specialist psychological service offering online and face-to-face therapy for people with kind of enduring or kind of chronic mental health problems. And we also have an ADHD assessment service for children, teens and adults.
Yeah, we were very excited about it.
We were. Well, that's a new development in the last 3 months, did you say?
Yes, last 3 months, yeah. Dr. James Sheeran is a clinical psychologist that works with me, and he has kind of pushed this forward, and he has done amazing work and has probably launched one of the best quality, I would say, ADHD services in the country in terms of what you get for it. Full IQ assessment included and things. So it's very comprehensive. It's very gold standard.
It was really interesting because, like, you just kind of said it in passing, and I was like, oh, I'm after having to get an OT referral for Bobby, my little fella, who I'm pretty sure has ADHD. It's not that I'm pretty sure, I'm not like diagnosing him. I don't want to medicate him or anything like that, but I do want to be able to deal with it properly, because at the moment he's getting in trouble for his behaviour because he's very disruptive and stuff like that.
Me too, yeah.
So I was like, I'd rather just have the referral. I'd rather, my favourite quote, better to be looking at it than looking for it. But the reason why I'm doing it now, he's not even school going age yet, is because I know how long the waiting lists are. So I'm thinking, hopefully by the time he's 8, we might have some sort of...
Why don't you
He's 4.
4. Okay,
Yeah.
cool.
Probably 10.
Yeah.
Probably 10,
No,
yeah, okay. So for anybody, I suppose let that be our first question. If anybody who does have a kid who's thinking about getting an assessment, because and I think everybody can kind of agree, it does seem an awful lot more prevalent these days. Or was it just that it was hidden back in the day? Or
I mean, sure, no, like we weren't
Nobody
testing for anything. We were
knows,
like, sure, it's grand.
yeah, they're grand.
It's just
It's just a boy. Or
Right,
that's
it's boys
that's
and
what his
boys.
nana says. Oh, he's a boy. You
And
know,
the girls
it's
are just little weirdos.
Yeah.
Leave them off.
So he's kind of, if anybody else is in the situation where they're kind of going, oh wait, no, or they could be on the list years already, and they do want to, because you said it, there was something you said before we started recording it as well, as like, it is a big upfront investment if you do want to go privately and get it done, but you'll have that until they're finished college, and there'll be so
the
many
rest of their
resources.
life, pretty
If you
much,
want to, explain it.
Yeah, so I suppose that the service that we've rolled out, it's been designed in such a way that it's diagnosed by process of elimination as well. So oftentimes boys and girls may have anxiety symptoms where they might find it hard to pay attention or have concentration. They might be a bit restless and irritable and fidgety, and that might result in them lashing out because they're getting in trouble for it. And so sometimes those symptoms can present as ADHD. So one of the things that we're very keen to do is to develop an evidence-based gold standard way of assessing ADHD. So for a lot of children, they might have dyslexia, they might have other kind of neurodivergent tendencies, and that'll make it very hard for them to engage in schoolwork. And so when they're sitting down to read something, they might be jumping up out of the chair or moving around and not sitting still and misbehaving. And if you label a child as bold, they will live to the label. Do you know what I mean? They'll really take that on. And so the purpose of an early assessment is to give children the chance, the best possible chance academically and socially to move forward. And, you know, the system that we've devised is that parents would meet the clinical psychologist on the team. And, you know, within that kind of meeting, the psychologist can usually say, you know, maybe it's not actually worth your while to pursue this. It sounds a lot more like anxiety, you know, or they might say, look, this actually does sound like ADHD. Do you want to pursue the assessment? So we give parents that choice. The benefits of pursuing the assessment is that you know declaratively whether or not your child has ADHD. You're given, you know, a 30+ page report on that with recommendations for the child, for the parents, for different things. And, you know, I suppose I want to be very clear with people that we don't prescribe medication for ADHD. We're a psychological service. So people would need to follow up with a psychiatrist for medications. What we do is we give recommendations. So it might be cognitive behavioral therapy for a few sessions to help the child kind of challenge those kind of negative thoughts that come about, practice relaxation skills, help them engage and emotionally regulate. And we'll also have recommendations for parents, and we do a lot of kind of parent training and parent education. The way for people, I suppose, hearing this is not to see that as the parents failing. It's to recognize that when you have a child that's neurodivergent, the skills that are required for that child are an enhanced set of skills. And so it's about kind of helping the parent get to that enhanced level of skills so they can understand what the child is going through and are able to kind of speak on their level. You know, it's a little bit like having a child speaking French and you speak English. You know, there's a barrier to communication there. So it's helping the parent and child learn a shared language to move forward. And then I suppose that the other benefit then of the assessment is that with the report, parents can use that report to access extra services in school. So that might be a case of having maybe a smaller classroom or a smaller setting for exams to help children pay attention more, or whatever that might be. And they can use that then in primary, secondary, and in university. And I can also advise people on like what kind of jobs might be best for you longer term if you're a bit older in life and you're thinking about that. So there's a whole host of benefits to it. So I suppose it depends on how people see it. And for people who have health insurance, some health insurance plans can cover quite a lot of the assessment as well. So
It's actually like it's and in your day to day, it's such a basic kind of thing. It's like, oh yeah, this is the service that we provide. Yeah, like that's grand. But for somebody who doesn't know all of the things that are available, and even like listening to you saying about the recommendations that you'd give to a parent, it's also about breaking that cycle of, because like we say, years ago you didn't really hear people getting diagnosed with these kinds of things, so they were just labelled as bold, and they might have grown up to be like a wild child, or you know, never got a job, or this kind of, you know what I mean. It is breaking that cycle. It's great to see the awareness that it's kind of brought.
absolutely. I mean, every child deserves the best possible chance in life. You know what I mean? And a lot of parents do their damnedest to give that to their child, but that's not always possible, especially when a child might have kind of severe mental health problems or might have ADHD or whatever the difficulty might be. And I suppose that's why if people go onto the website cbtsolutions.ie, Dr. James Sheeran has designed an excellent pamphlet for parents and children on that. So when they click the link, it'll actually download a PDF and parents can read through that and they can get a sense of the questionnaires that we complete with the child, and then what's involved for the child, the parents, and the benefits of doing it. So if people are interested, cbtsolutions.ie.
We can link it all below for you.
Perfect.
So much easier. We can just click on into the description there and it's right there. So we were talking about kids there, and obviously it's something that, like, I think we all know that there's like, we have the trend of neurospicy, which is like a big thing obviously on TikTok. But again, it's good that people are like talking about it. Yeah. Because then obviously you have that like older age group who are like, everybody has something wrong with them nowadays. I'm like, no, Brenda, you just didn't figure out that you did. So now, like, again, you're raging. It's kind of like the student debt situation in the US. Just because you didn't have it doesn't mean that others can't. Yeah. So for adults, this is something that is obviously available for them too. But I suppose, like, the problem is with general indicators, and what I always feel like when you read down a list of like some symptoms, everything's in there. Yeah. Like extreme anger, I'm like, yeah. Extreme sadness, sure. Cry sometimes, absolutely. It's like irritability every day, you know. And it's, I suppose it's that kind of way of like how to get that pre-indicator before possibly assessment, or what are some like maybe resources or ways of, I suppose it's really hard as an adult sometimes to convince yourself to do things. I mean, you have to be at me to go to the GP sometimes, because I just don't want to talk to the receptionist. But like, that's just me. So I do find that it's hard almost to get adults to actually action. Yeah. And to figure out what the problem is. Because I know from a lot of our listener suggestions and a lot of like, you know, personal experience as well, when there is a neurodivergent tendency or a problem, a lot of it can lead to addiction quite easily. And that's kind of something that's used as a crutch. And I think that obviously in Ireland, we have a larger stigma around, I suppose, seeking help, and also kind of trying to better yourself sometimes in some ways, whether that be, you know, therapy or any kind of movement on trying to make progress with yourself. So I suppose it's a very long-winded question and a very long-winded way of asking, like, what would be your best kind of step one for an adult who thinks that they might have a level of neurodivergence?
The first thing I would ask is, how much do you think it's impacting the quality of your life? I mean, a problem's not a problem until it's an actual problem. Do you know what I mean? That, like, you know, I might have anxiety, but it's not very pervasive. I don't have it every day. It comes and goes, and it's kind of in a normal range of anxiety. If you're experiencing anxiety to the point that it's stopping you from doing something that you want to do, or you feel like you're losing a little part of yourself, the question I'd ask people is, A, how much of a problem is it for you? And B, if you compare yourself to where you're at this year in your life versus where you were last year in your life, have things improved or have they gotten worse? And if they're going to improve, how do you foresee that happening? And do you have the skills and plan in place to do that? And if the answer is no to those, then maybe it's worth your while, A, getting an assessment for the ADHD, if that's what you feel is your problem. Or if it's more of a kind of classic mental health problem like OCD, anxiety, or whatever that might be, to recognize that there are services available. Like, we host an awful lot of psychotherapy, both online and face-to-face, because a lot of people, I suppose, we're a specialist psychological practice. A lot of people don't want to travel for that, or they can't travel. I mean, I'm not driving to Tralee for therapy, you know, but we can offer that online, and online therapy is just as effective as face-to-face. I suppose the only times where I'd maybe discourage online is where you're maybe talking about a relationship where there's domestic violence and you actually need to get out of the house, or where you've experienced extreme trauma and you might need a place to park that in a room. But that's what I would be encouraging people.
Yeah. So that you're not in the same, like not
It's taking yourself out of the environment.
Absolutely, yeah. Because you can leave it with the clinician in the room and go home and have your processing space. You're not reliving it in your own home. Whereas if it's anxiety or OCD or depression, like, all the research indicates that it's the exact same treatment outcomes whether you do it online or face to face. Plus, it's a lot more convenient for people.
It's a lot more accessible for people as well, especially if they live in kind of a rural setting, or if they don't drive, or
massively. Like, I had a person coming up from kind of Wexford, you know, and it was about an hour and 40-minute drive, and I said to them, you know, like, we can do this online. They were like, oh my god, didn't think that was an option. That's excellent, let's do it online, you know. And that person has done really well, you know. But I suppose that the role of therapy or the assessment is for people to really ask, am I where I want to be in my life? And if the answer is no, and it was the same answer last year, well, if you want things to change, what are you actively going to do about it? And people will kind of, you know, there's barriers inevitably, like, I don't have time, or I don't have the money, or I don't have the energy, or whatever it is. And it's like, well, okay, well, are you going to be happy with yourself if it continues for another year? Actually, probably not. Well, the cost of therapy is the equivalent to a cost of a night out.
Yeah.
And if I asked you to go, you know.
Sorry, a night out's triple the price probably nowadays. The way I'm attacking it.
Those taxis don't come cheap. But I suppose, you know, for people to recognize that in order to move to where you want to be in your life, it requires making a sacrifice and making an investment in yourself. And therapy is not there to help you. Therapy is there to give you skills to move on and develop in your life and get to where you want to be. And for a lot of people, they're in relationships and they're not very happy. And that's not to say that that's not the right person for them. That relationship might be great if they both worked on their skills together. And usually if one person changes, it does promote change through modeling certain behaviors or more positive ways of engaging with people or handling conflict and stuff, you know. And that's something that we've seen an explosion of, especially in the online space, where people are like, yeah, I'm with this person, you know, we're together 3 years, we're thinking about getting married and we've got all these problems. Great, well, that's okay. Like, you know, every problem is just a solution waiting to be found. Which is why we're called CBT Solutions, obviously. But, you know, it's about trying to help people to move forward in life and to get those skills and integrate them. And the long-term benefit is you pass them down to your children. You have a legacy effect. So it does break that generational piece too, you know?
That's a lot of things that I see people. Obviously, there's so much more awareness when it comes to mental health and people, like, working on themselves and stuff. But a big thing that I hear is, like, breaking the chain or the generational trauma, like breaking that so that you're not passing it on to your own kids as well. And I think one thing that you said in there as well that I want to kind of, I think we're, and especially in Ireland, because we're told not to have these notions, we don't really see the worth when it comes to spending money on ourselves for
Yeah.
for stuff like therapy and stuff.
Yeah.
So you do need to change our mindset around that as well.
I think that's very sad though.
Yeah.
That people wouldn't see themselves as worth the money.
But it's so prevalent.
Yeah. Oh, absolutely. That
And it's
doesn't make it less
mindset.
sad.
Yeah, no, absolutely.
I
I think
know.
it's like it's that level of mindset I think that we have. It's tough as well because there is I feel like this country is like a bubble of generational trauma. And like look at our history. I don't blame us either,
Absolutely.
but I also think that we're a great nation of like galvanizing and moving forward.
Yeah.
So the more information and the more resource, I suppose, is best. Something that we did actually, we kind of asked, and you kind of vaguely touched on it there, and it's something that I saw a lot of your videos this week talking about, and it's a lot about.
Oh no.
you're like oh dear, but I thought it was really interesting because it's those little things that get people thinking. Like when you put in those bite-sized kind of sections of just like breaking down. You know, it was the one that you were talking about, like passive aggressive and resentment, or passive aggressive comments and in relationships, and so it was one of those. I can't remember
They
specific.
foster resentment.
Yeah,
in people,
the resentment piece. Yeah. And a lot of the questions that we had when we asked our listeners, a lot of people kind of seem to have the same resentment problem with their partner, and it kind of seems to be always about the same things.
Of course it is.
And it's crazy because I'm like, I feel like, are we all living the same life? Are we all like, not even are we all living the same life, but I'm like, a lot of the stuff that people are like, I'm, again, very lucky in where I am in my relationship now, but like definitely things that I've previously dealt with. And a lot of it is like a rate of maturity between two partners, or a kind of build up of not aggression. Aggression's probably the wrong word. Like resentment, but like that kind of tick.
Irritable.
Yeah, that irritability between two people, and ways of kind of coping and dealing with that. Because sometimes I think as well, you can't do right for doing wrong, and you almost, particularly what I've seen in Ireland, is people can kind of have these legacy relationships. They're long term, a lot of investment gone in there, and they feel like they've hit a certain age or they've hit a certain point. Maybe they have a child, maybe they have a house.
Yeah, we're going to get married, so
Yeah.
I don't want to lose it now. Because,
Yeah, it's like I'm 39. I've kind of committed this amount of my life to this person. How, I suppose, in what is the best resource, or what is the best way to even start attacking those issues?
I suppose that like you asked that question, like are we all living the same life?
Yeah.
And I think we all share the human experience, but everyone experiences it differently.
Yeah.
You know, and I think that passive aggressive behavior in relationships comes about because people haven't expressed their needs. So for example, if my partner has a thing about the house being clean, right? And, you know, something's happened to me and, you know, I feel she's at fault, and I'm assuming she knows how I feel, because why wouldn't she? She loves me, so she should understand exactly how I feel about everything. Do you know what I mean? I don't then need to communicate my needs or how I'm feeling to her, but then she doesn't pick up on that because how could she? I haven't told her. So because she wants the house to be clean, I make a bit of a mess, or I leave a few crumbs in the counter because I know that'll really get to her. Do you know what I mean? And so like that might seem like really petty to people, and it is. But but it's only going to be passive aggressive because you know doing it is going to upset that person, and then when they get upset about it, you can be like, I don't know why you're overreacting. It's only a few crumbs on the counter, but you've done that to
Purposefully.
upset them. And then when they get upset, you gaslight them into being like, well, I don't understand why this is such a big deal for you. And it's like, well, oh yeah, maybe I am overreacting. Yeah, you always overreact. And then I can kind of lay it on how angry I am over something that's happened previously. Do you know what I mean? And so people kind of like live in silence in these kind of silos where they live parallel lives, but they don't converge. And then they're looking for an excuse to kind of lash out at somebody. And so what I try and encourage like all of my patients to do is to kind of maybe start to write down those times where either you or your partner was passive aggressive, and ask yourself, what was it that happened between you and your partner in that moment, in the build up to it, that made you feel that was a good idea? So why did I put the breadcrumbs on the counter that time? Or, you know what I mean? Well, I was really annoyed that I came home from work and I was clearly in a bad mood and she didn't ask me about it, or, you know, she didn't try and cheer me up. Okay, well, did you ask her to? Well, no, I shouldn't have to. Well, then you're going on one of the big cognitive errors in relationships, which is that if you love me, you should read my mind. People can't read minds, but what happens in those relationships, everybody's making assumptions what the other person's thinking, and no one's actually communicating. So nobody's actually meeting. they're just kind of drifting past each other and gently touching off each other at the odd time. That's a huge problem. So that needs to be addressed. And for a lot of people, like a lot of our patients that come to us, it's about teaching them certain assertiveness skills training, because you have to tolerate the vulnerability of it, because it's awful to have to go to your partner, no matter how skilled you are, say, actually, I'm not really happy with this, or actually, can we have a check-in here with the relationship? Like, are you really genuinely happy the way things are going here? And if they go, yeah, well, okay, well, I'm not. Like, I think you're great, I think you're fantastic, but I've just noticed X, Y, and Z, and I'm just wondering, is there any way we can work on this to reduce this happening? It's not about completely stopping the behavior, it's about actively trying to reduce it. Whereas a lot of people kind of misconstrue that as, oh, well, I've addressed it now, it should definitely stop. But that's gone on for a long time. That takes time to change. It's like anxiety. It doesn't just kind of, you go for one session and you're cured. If that was the case, I'd be a millionaire, you know. But like it does take time. But a relationship is about kind of recognizing two people need to make big sacrifices and need to have a lot of difficult conversations to have an easy relationship, you know. And so, you know, even just like 2-3 times a year, sit down with your partner, no screens, have some food together, face each other, and a genuine kind of, am I actually happy? Like, are you happy with this? Or am I doing anything that's kind of annoying you? And they might go, actually, Carla, yeah, you're doing X, Y, and Z. And you might say, okay, I didn't realize that. I wish you told me that. Yeah, well, I've told you now. Okay, well, what would you like me to do differently? And then flip it to them and go, well, I've noticed you do X, Y, and Z. I'm not having a go with you. I love you. I want to make this work. And then have that conversation. But that requires an awful lot of emotional regulation to bring down the defenses. You need to be able to quite quickly cognitively restructure yourself to kind of get your thoughts aligned and then be able to communicate that. So we do an awful lot of assertiveness training for couples trying to do that kind of work, you know?
Yeah, because I was going to say, do you find that there is like an uptake, I suppose, in couples actually coming to seek like any kind of assessment or I suppose therapy?
Couples no, women yes. I think men, sweeping statement, but as a man I can
no,
make
but
it.
that's another that's actually one of our questions from
Is
our
it?
listeners saying, I feel like I'm doing the work on myself and he's not meeting me halfway.
Yeah.
And like how to kind of, I suppose, they're like, I want to be with him. I've committed to this.
Yeah.
I'm like, okay, that's a
Why?
lot. But I'm like, whoa. But also I think it's yeah, that's something that keeps coming up where again, like women almost have to breach the fence and then men might follow, or you know.
Yeah, I suppose it depends on the amount of difficulty a person's experiencing in it. Like men tend to be, I don't think easier going is the right word, but I think men tend to maybe not notice the emotional side of a relationship to the same extent that women do.
Yeah.
So for men, once the ship is kind of running smoothly, there's no big problems. You know what I mean? Whereas women might be like, actually, maybe there's a couple of problems here. I feel there's a lack of connection, which is absolutely reasonable. So women tend to be the first port of call because they tend to be quicker to recognize their own emotional distress in something than men do. Men have a get on with it attitude, which is fine to an extent, but it can blindside you then when things aren't going well. So a lot of our clients, like we do one-to-one work, we would have about 30% of the people that come to us are males and 70% are females for relationship specific issues.
Yeah.
Would you get many couples?
So we don't do couples work.
Oh, okay.
Like I have done couples work in the past, but not specific marriage counselling.
Right.
So normally what I would do in that situation is I might take the man or the woman or whoever or two men or whatever way it is, and I might do say 3 or 4 sessions with them, then 3 or 4 sessions with their partner, and then have a joint session to see how the skills have been working on each other, and then we can kind of hash that out in the room, you know. But obviously it's a much, like the average session is 50 minutes that we do. With the couples work, it's about an hour and 20 minutes because there's a lot more in it. You
A
know
lot
what
more
I mean?
conversation probably as
There
well.
is, and you have to hold a lot of it because there might be a lot of resentment in the room, and you really have to kind of.
That must be
That's what I was
tough.
going. Well, I was going to ask you, having done couples sessions in the past compared to what you do now, and I'm not asking you. Like I know there's probably a professional answer to this, but the Conal answer, like your personal, what do you find to kind of be better, like, or is that do you don't need to answer if you don't want to?
Yeah, no, I'm happy to answer it. I think problems in relationships are they tend to kind of flip flop and tend to be more one sided in one hand than another. You know what I mean? And I think that it's very rare people have a shared problem in relationship unless it's specifically around communication. You know. But usually it's a bigger problem for one person than the other, and then it just becomes a big problem for the other person because it's such a big problem for the first person. You know, So I suppose it really depends. Also, the level of ownership and responsibility people are willing to take over the problems that are in their relationships. Because I'm not perfect, and I'm sure I make lots of mistakes all the time. I have a very patient partner, thankfully. But it's about us kind of saying, okay, well, something's gone wrong here. What is it? How has it impacted you? How has it impacted me? And it doesn't need to be a kind of, in inverted commas, the therapy speak, but it's like, listen, I'm actually really upset that you did that. I'm just kind of wondering what happened with you that you thought that was a good, like what went through your mind kind of thing, and for them to be like, oh, geez, actually he was completely oblivious. Okay, I just noticed you've done it a few times today.
Yeah.
I'm just, is there something going on between us? And then your partner might say, actually, this, and this. Okay, right. Let's sit down and hash that out. Do you know what I mean? But ideally, you don't need to come to that. You can kind of go at the start and go, listen, I'd rather you didn't do that anymore, and have a kind of a one-to-one. But normally in a relationship, if one person can learn the skills, they can model those skills to that individual. But people don't, like, the only thing that motivates people for change is pain. And so if people aren't in enough pain or distress, they're not going to change. So for that listener there who's like, I'm doing therapy, I'm doing a lot of work on myself, I'm trying to push them forward, I'd suggest that you give yourself a time limit on that. And so I always kind of suggest it's an arbitrary time, but give yourself 10% of the relationship. So if you're with them 36 months, give it 3.5 months and try, and then have active things you can measure that change against. So what are the problems? They're A, B, and C. They're super concrete. Try and invest in change. Highlight the problems to him. Highlight the impact it's having on you. Get him to commit to change if he's open to it. Find out what your own faults are. And then every month kind of just look at your list or your box of changes and say, well, how many of them have actually been met?
Okay.
Oh God, none of them. Okay, maybe try another month. Still none of them, even after having that conversation monthly. At around 3-4 months,
you'll have your answer.
You will.
Yeah. Wow.
That's a really good tool.
Yeah, that's a fantastic.
That's
tool.
a fantastic tool, Conal.
It was the first time that Jesus, do you do this professionally?
Did you study for this?
Why are you about writing so much?
Me there.
It was really our question. It was really our
Yeah.
Who is this listener?
Me there, like, better rewrite that. No, I think something else that has kind of come up a good bit is people are like, when to know to actually, not only when to know to seek therapy, but when to know to go to, I suppose, counselling versus going to something like cognitive behavioural therapy.
Yeah.
So like the difference is, I suppose, in that, because again, resource is a mad thing. I feel like Google's right there, but also it can be really, really confusing
don't know
trying
what
to
you're
figure
looking
this
for,
out.
yeah.
Yeah.
That's a really good question. I'm going to take a very scenic route to answering that, if that's okay.
That's fine.
I suppose when people think of cognitive behavioral therapy, it comes in different flavors and grades. There's a lot of people, like, CBT is a buzzword. Whether you can spell it or not, CBT is a buzzword, and for a lot of people, they're looking for a counselor or a therapist that has CBT training. But like, for a lot of people, it's a bit of a cowboy industry. A lot of people aren't trained properly in it, and they've got very basic CBT skills.
Yeah.
And I noticed this. I do a little bit of lecturing in the Trinity postgraduate program. I do a lot of private lectures in kind of advanced CBT techniques to clinicians. And you quickly realize there are people that are saying they're CBT trained, and you kind of go, God, I hope I don't, have to ever go to you for any problems, because it wouldn't be maybe the standard that I'd be expecting.
You're like, it's not giving CBT.
Yeah. It's taking it, actually, I suppose counselling is more of a facilitative space to allow people to process certain things, and it tends not to be very confrontational. CBT tends to be a lot more structured, evidence-based, shorter term, problem specific and goal orientated. And I suppose that the specialist service we offer is taking, so if you have an umbrella where you've got psychotherapy, under that umbrella you have CBT, or cognitive behavioural therapy. So that kind of started in the 1950s and 60s with Albert Ellis, developed rational emotive behavioural therapy. Then Aaron Beck formed cognitive therapy, and then you had behaviourists like Skinner all the way up to kind of like the last kind of 10 years. There's been waves 1, 2, 3, and 4 over the last few decades.
God, you're bringing me back to my my 1 year that I did of psychology.
There you go.
I was like, I know all these guys.
and one of the things that people who are trained in CBT are trained in kind of first and second wave, which is like the super basic CBT, like let's challenge thoughts or let's change behaviors. The newer waves of CBT, which is kind of compassion focused therapy. So under the umbrella of CBT, you've compassion focused therapy, schema therapy, dialectical behavioral therapy, radically open acceptance therapy. There's loads of different ones. And I suppose a good CBT therapist will be able to practice all 4 waves of CBT to create a much more rounded, well-focused package that's individually based, and that's what we do.
I was going to say, if you don't do that, I don't want you on this podcast
Yeah.
anymore. If you can only do 2 of them.
I've talked myself out the door. But I suppose, like, for us being a specialist service, we aim to deliver the highest quality therapy people can get, and we do it in a way that's supportive, facilitative, but also calls people out on certain things where, like, well, you're saying this, but actually you're doing this. Can you try and make sense of that with me? Because we're not there to shelter people, because a lot of people, they've tough lives, and the purposes of our sessions are to bring people in, try and allow them to feel the hardship they feel outside, and then give them skills to practice in that moment with them, you know. So, like, I have a lot of perfectionistic clients, and I get them to do work in between the sessions, and they'll send it to me. So when they sit down, I say, God, there was a few spelling mistakes in that, and I'll see their face completely drop, and I go, now just catch what's happened for you there. And they're like, oh my God, this is what happens to me all the time in the real world.
Yeah.
It's like, great, let's work through this, try and catch that process then in the real world. Whereas counseling, a lot of people go to counseling and the first session is like this 10 out of 10 cathartic discharge, and like, wow, that was all about me, that was super. But then session 2, it's 9 out of 10, 3, you know, and starts slipping. And then after like 10, 15 sessions, the underlying problem hasn't been treated because it hasn't been targeted.
Yeah.
But they're kind of like sick of talking about themselves, and they're like, well, how do I convert this to action now? So we meet a lot of people who are coming to us as a bit of a last chance saloon, and they're like, look, I've been to a few therapists, it hasn't worked, I'm beginning to feel the problem is me. We say, well, it's not. Like, if therapy's not working for you, it's because therapy's not working, full stop.
Yeah.
Do you know what I mean? And so we're there to make sure that people are looked after, and we sit down and go, look, what do you actually want? And so the question I ask people, and they should always have this in their head if they're going to therapy, is if you do 8 sessions, 10 sessions, 12 sessions, 20 sessions, whatever session number it is, what do you actually want to be different about you or your life or the way you're living your life day to day at the end of that? So you've got a very focused goal to work on with your clinician. So it's actively trying to get you to where you want to be, not just listening to you hash out kind of the same story. Because, you know, and people are always kind of a bit shocked when I say this, but like, I don't care how people's weeks have been, you know what I mean? Because it's not the last week that's brought them to therapy.
Yeah.
I'm curious as to why the problem is maintaining the way it is when they know that's not what they want to do. So what's the block?
It's just, I'm like, woo.
Jen's like, whoa.
No, but it's just, as you're speaking, I'm like, that's why people go to therapy for fucking years and nothing ever changes. And I think, and you were here last year, obviously, and our minds were blown when you left.
Thank you.
And
In a good way.
in a good
Imagine
way.
that was shite.
But
Let's
this
never
is
have him
just-
on again.
He was brutal.
But this is just another stark reminder of the difference between CBT and therapy. And like, it's just mad. I'm just like, maybe I need this CBT.
I think it's because I hear a lot of people, like, I know a good few people who've gone to therapy for years and will switch up counsellors because they're like, I just wasn't
counsellor's
vibing with that
problem.
one.
Yeah.
And I'm like, okay. And then I do know a lot of people, primarily older, like I would say over the ages of 50, who have gone to like a counselling session. They were told that they were the victim. They're like, stunning. That's it. Slade the house down boots. I know it wasn't my fault.
Yeah.
And it's like, oh God.
And for some people, like, they might be the victim, and that's fine. And if people are happy to see themselves as a victim, that's fine. I don't think that's helpful for people, because I think if you see yourself as a victim, you'll always see yourself as oppressed. So life is harder than it needs to be.
Okay.
I think, you know, the kind of common kind of wording now is to change that from victim to survivor, where, you know, you survive and thrive in inverted commas, you know, and it's about kind of saying to someone like, yeah, you have had a really difficult life and things haven't been easy for you, but how do you want to live the rest of it?
So I say, so that's cool.
Okay.
That happened.
So
Yeah.
no, it's like, so let's process the trauma and the grief and the sadness and the pain that went with that. But like, also, what do you want to be doing differently day to day? Like, what's actually going on with you, and how much? Because like, for a lot of people, they learn the certain skills and they might not need to dip into the past too much. But then there's certain skills where they're trying to put them in place, and there's like a stumbling block there. And it's like, right, okay. So like, you take someone who's classically depressed, like, they'll often have like critical parents, and parents can be critical and kind of play it off as a joke, which is absolutely disgusting because children don't understand those jokes, you know. But if you're critical of your child, like, you're their world. So the child interprets that as the world criticizing them. So they begin to believe they're not good enough. So like, that becomes their thing. So if you imagine that's like the roots of the tree. So everything that grows from that is growing from the not good enough. So they'll try and make extra efforts to be good enough in what they do in life. So like when like people are, I don't know why I'm so triggered by criticism. And then they kind of go, well, do you ever feel not good enough? Jesus, actually, yeah, that really clicked for me. And you go, well, that's why. Like, you know, so if people are struggling to put skills in, you go back to what's the root cause? How do we unpack that, clean the roots off, replant and grow a different way? And it's not that the person's wrong or at fault. It's like, you know, you are, to use your word, like you're a victim of circumstance in life, but you don't have to be. Like you can turn that around for yourself. Like life is unfair and life is hard. But it's up to you if you want to continue that hardship or not. And like that's the role of really good quality evidence-based psychotherapy, is to help people move away from that.
Yeah.
You know, inspire hope and change.
Yeah.
Yeah, it's like it's really like it's more focused on providing the tools to be empowered with.
Absolutely.
You know, like,
and surround yourself with people that do that. Like
Yeah.
if you say something to your partner that you're keen on doing and they run you down for doing it, why are you with that person?
Yeah.
Like that's not going to
mad.
help you. It is, but a lot of people are like that. Like, and you often see couples where, you know, she or he will say something or whatever and their partner will criticize them for saying it. It's like, and you can almost like feel the life drain from them. Do you know what I mean? You can see the shoulders sag and the crest fallen. Okay.
I'd say you're great in social situation. Imagine in a big setting down the pub, you'd be like trying to not make eye contact.
Yeah, but I would never criticize, you know, my partner in that way, because I think that like your role of being a good partner is like you're your own hype person for them. Do you know what I mean? And like if you don't have somebody in your corner is a very lonely place. And in order to have someone in your corner, you have to kind of worth being there for, and that means you have to step up as well. So it's about and that's what I mean about the responsibility piece and recognizing that.
Yeah. Very interesting. I think another thing that I see a lot, I think, because we're kind of flipping between what people have asked us and also like what we're kind of picking up on, I suppose, the trends of the day.
But then do you know what it is? It's the amount of people on social media going, oh, I had depression, oh, I had that, and they're self-diagnosing, and it kind of is trendy to have something like ADHD or be neurodivergent without.
I think, and this is how I pick it up, but it's because we talk about it a lot as well, where it's like, I think everyone's looking to be related to in some way or form. They want to kind of see themselves, like, people kind of want to be unicorns, but they also want to know that they're not alone. But they also, like, they want, you know, help and they want community. But then, you know, boundaries is a big thing right now. And, like, not a big thing. It's a big thing for everybody, should be in their lives, because, you know, we're not great with them. But I suppose it's again, it's like your TikTok and everything else like that, where kind of people are coming out and as you said, self-diagnosing, but self-diagnosing and not doing anything with it, being like, perfect, that's me.
Yeah.
And then just kind of like moving on ahead. I've got my favorite creator and they're going to tell me everything that I need to know.
Yeah. Well,
full stop.
You see, I think people like the idea of a diagnosis because it explains their experience.
Yeah.
And like that's a really good first step. But again, like people don't need to do anything about that unless it's causing them hassle. You know, like if I do a TikTok or Instagram quiz and it's like, Jesus, I'm 6 out of 10 depressed. Like, I don't know what that actually means. Do you know what I mean? Like I'm 60% depressed.
Just walking away.
But like I'm kind of like, okay, grand, I'm happy to know that, like kind of thing.
Yeah.
But like actually when I ask myself, well, how much of a problem is it for me really? Like on a scale of 1 to 10, this is what I ask everybody, on a scale of 1 to 10, how happy are you with your life right now?
Yeah.
Most people kind of go, ooh, 4.
Yeah.
You know, like there's very few people are going, yeah, I'm a 9.
Yeah.
Do you know what I mean?
Yeah.
And I actually think that's kind of sad. Like, I mean, like you don't have to be a 9 or a 10, like, but you know, 7's pretty good. You know what I mean? Like, and there's times in your life where, you know, that might dip to a 2 or a 3 or whatever. But it's like, on the whole, over the course of a week, how many 7s did you actually get? You know, and if you're getting like, you know, kind of less than 5 every day for 2 or 3 weeks, maybe that's maybe not where you want to be, like, you know.
Sure. Yeah. And I think something, because we were talking about earlier, is the kind of the new insertion of and I think it's a really interesting conversation, because I see not both sides, but I do see both points where this kind of new speak of boundaries is destroying community in a way that people are like, you know, if I ask for a lift to the airport, it's like, and I say no and you're kind of annoyed at me, you know, I've expressed a boundary. But it's like, but we should be doing favors for our community, which is our family and our friends.
But if you ask me to do something, then you have to be open to me saying no, don't you?
Yeah, true. But I did think it was an interesting kind of conversation, because I think there's a lot of back and forth about it. And you know, when you watch something, you're like, interesting. And then something else, you're like, oh, never saw it that way. Or like even there, you're like, oh, gas, yeah. You know, you can't say, you know. But I think that because of COVID and because of a lot of other things, people are they're a little bit more used to being alone now, let's just say.
Big time.
And that kind of level of community, I even think in like our age group has been like, you know, it's a little bit less than maybe the generation previous to us. And then you see Gen Z and you kind of see that, like, you see all these, like, you know, these reports coming out saying they're like loneliest generation like yet, and it's kind of, it's almost getting worse because we're so used to our phones and, you know, having digital relationships and, you know, not expressing things, and that in turn is leading to massive mental health issues because people aren't getting that kind of, I suppose, that life cycle, that you know that the wild 20s and whatever 30s and all that kind of, like, I suppose those typical life experiences. But then when do they stop becoming typical in another way? Because that's how, like, the world had to adapt. We've all adapted, and now we kind of move forward. But I did think it was an interesting conversation about, like, how much we hear about boundaries nowadays. And look, as I said, in Ireland, we probably need a lot more of them than, you know, than we don't need them. But sometimes people use boundaries as an excuse for bad behavior, or not even bad behavior, selfish behavior, possibly.
Can you give me an example?
Like, let's, again, for instance, I think that I've helped you paint your house.
Okay.
And you bought a house 2 years ago. We painted it together. It was a great time. We all had a bit of a laugh. It's coming up to me deciding that I want to paint my house. And I suppose my expectation is there as well to kind of, to ask you to help me.
Okay.
And it's a very quick shutdown. It's kind of like, no, not even a no. It's like, why would I, like, not even why would I be doing that? But yeah, kind of a level of like, doesn't work for me. Again, those things are fine. But then there's like a level of, there's that build of like resentment. And it's like, well, right now I'm struggling with, you know, or right now I don't have the time because of the kids, or right now I don't have this, that, or the other. And there's kind of like, there's a rationale, but you still feel like let down, or you feel like, you know, and then it's kind of this boundary play. It's like, well, I expressed to you that I have like these other things going on, and but then there's no like resolution. It's not like, I'll help you next weekend or that other kind of stuff. So that, and again, like, let's say the lift to the airport situation where it's like, I
Change your
give,
friends.
yeah. So it's that kind of, I suppose what I see is like, if we continue to not support our community, which again, friends and family or whatever way you want to see community, if you continue to kind of like reject this notion and become this solo regulator, or this person that like only answers to themselves, how are we going to continue to develop to have like good relationships with each other without it being like, that's a boundary of mine?
Yeah. So I think the only problem with boundaries is in how they're communicated. So like, if you've helped me clean my house, the difficulty that we might have, like, oh, sorry, let's say I help you, I paint your house.
We were painting, actually. Yeah. We were actually painting.
Oh, okay. I actually have to go. But like, let's say that, you know, I help you paint your house, right? But you didn't necessarily ask me. I offered. But and let's imagine that I'm maybe higher up in the people-pleasing spectrum. So the only way I'll be happy is if I make some kind of self-sacrifice to help you out by painting your house, right? Then I might have a grandiose expectation that you'll help me out, but that's never actually been communicated. Do you know what I mean?
Yeah.
And then I'm kind of like, oh, would you mind coming down next Saturday and painting my house? And you're kind of like, no, like, and I'm like, well, I helped you, and you're like, well, I never asked to.
Yeah.
Do you know what I mean? Like in that case, I think that's kind of reasonable. Do you know what I mean? Because I offered services and there was no conditions attached to them. Do you know what I mean? It was just like, there's usually an expectation that's quid pro quo or tit for tat in some way. So for me, if a friend popped down to help me paint my house and they were then like, look, can you help me paint mine next Saturday? Like, if I genuinely couldn't make it on that Saturday, I'd say, listen, unfortunately, I can't this Saturday because of X, Y, and Z, but I'd be very happy to pop down the Sunday or the weekend after and help you with something else if the painting's done. Like, so I'm still expressing a boundary, but I'm offering a follow-up to try and consolidate for the fact that I recognize, yeah, you did help me. I did appreciate that at the time. I was happy to take your help, and I do kind of owe you in a certain way. You know what I mean? I think that the difficulty is that when people are in a family dynamic, and the problem with families is that they're templates. So if you have a people pleaser in the family, and I'm just using that language because it's a bit easier to kind of talk about, but like if you have someone that's a people pleaser in the family, they'll consistently put themselves out for other people, but sometimes they overstretch the limits of what they can do to the point that it's actually self-sacrificing. And then there's kind of like, okay, well, I've gave you left the airport now, so I'm actually going to the airport tonight. And you're like, well, that's too short notice. Like, I've got something on, and I'm raging now because I gave you a lift to the airport at 2 a.m. But like, it's up to me to kind of say to you, actually, I'm flying on Thursday next week, give you enough forewarning. Is there any chance you give me a lift to the airport then? And if you say, listen, I actually have something booked, I can't, but like, you know, I'll collect you or something like that. That's pretty reasonable. So it depends on what the ask is from people. Like if someone asked me, you know, this evening, oh, would you mind popping in and doing this? Like I was in clinic and now I'm on a podcast. I couldn't.
You're like, I'm flat out over here.
You know, like, but I'm very happy to do it if it can work around things that I can't change. Like I've made commitments to patients that I'm not going to change last minute because it wouldn't be right to them. But like if I'm popping to Super Value and just going to the gym and someone who's close to me is like, I'm actually stuck for a lift, of course I'll drop the gym or I'll drop something because it's not that important to my priority list. Whereas kind of, you know, my patients are obviously number one because I'm a clinician. Do you know what I mean? So that's going to take precedence. But if people give me prior warning, I'll try and arrange things around that.
Interesting. Like, again, it's one of those things that when I see it come up, I'm like, yeah. And then next video, I'm like, oh, maybe not. Or
Who is the asshole?
Yeah,
It's the, am I
it's
the
like, am I
asshole?
the asshole?
Do you ever go through them?
Yeah.
Am I the asshole?
they're always wild.
Yeah.
They're always mad.
But I think that like with that, like the whole point of that whole people pleasing piece is that like people are like, oh, I like to make people happy. No, you don't. You just can't tolerate disappointing people or assuming people are disappointed with you. So it's like, oh, I'll do that now and it'll make them happy. Okay, so if you don't do it, they won't be happy. Yeah, but they'll be disappointed if I don't do it. Okay, what's so bad about that? Oh, I'd hate for them to feel like that because that's how they feel. So they project that feeling onto other people and assume if I feel this bad about it, you guys are going to feel terrible about it. So I definitely can't let you down. Whereas like most people are actually able to tolerate disappointment. Like, you know what I mean? So just people to be aware of
We've
that.
all experienced it. So
Yeah, absolutely.
Yeah.
And it's okay. Like it's, you know, it's character building as long as it's not frequent and abrupt all the time.
I am just after realising in my relationship because I can't understand how, like, I would be a people pleaser.
Yes.
Whereas Adam would be like, what's the big deal? Like,
Yeah.
say no. Do you know? And I find that foreign. Do you know? Whereas he, now I'm like, the bastard was right. Fucking and just, and my mind is getting blown here. I need to fucking leave. Do you want to carry on the rest of this?
Something else that actually we had a lot of was people trying to coax their parents into therapy or into like investigating and I know it's such a mad thing, but we have had a lot of people being like, I think
Depends on the parent.
Depends on the parent, but I suppose it like a lot of it was kind of like my parent is displaying like maybe like not so much manic behavior, but like a level of behavior that's becoming disturbing to what they know of. And I think there's a lot of miseducation when it comes to like perimenopause and menopause in women and like how much that can affect hormone changes and all that kind of stuff. And then just straight up being like, I think there's something wrong, but I don't know how to approach it. And I don't know how to like coax them into, I suppose, like a therapy situation. Because like they won't talk to their GP about it. And it's almost like, I feel bad for the children because it's like they are pushing the
They're becoming the parents.
Yeah, it's like they're the ones who are like pushing it up the hill. But I suppose there was like, is there any advice or any kind of resource that you would recommend to help people try and open the conversation maybe?
Yeah, I suppose when people are talking about coaxing parents into therapy, it's because they're at their wits' end and they're like, okay, I actually can't do this, so I need a professional to step in here and sort this out because it's just grating on me so heavily.
And they want to be present in their lives, obviously.
Absolutely, but the challenge with that is that when something's gone on for so long, you're so reactive rather than proactive that people tend to be maybe a little bit more adversarial or defensive than they mean to be when trying to coax or strong arm someone into therapy. And part of trying to encourage people into therapy, it's not to manipulate them into therapy because they have to make their own decisions on it, but it's to take a more inquisitive route, which is like, you know, you ask questions about how that person has been. So you might kind of like, oh, I've noticed, like, how are you feeling recently? I've just noticed you're kind of a bit off with me. Jesus, I haven't noticed that? Yeah, I've just noticed. Have you not noticed being off with anybody, or have you noticed that yourself? Yeah, I suppose I have been a bit. All right, and like, is that what you want to be doing, or like, do you feel you're falling out with people? Yeah, I'm falling out with them more than I'd like to be. Yeah, I just noticed you're falling out with people, you're falling out with me, and obviously I love you very much and like I want the best for you, and it just seems that maybe the places you're at is maybe not where you want to be, and like, would you think about doing something about it, or what do you think would help? So you're helping them problem solve what the problem might be. And I say, I don't really know what it is. Well, would you think about maybe speaking to someone, trying to figure it out? Like, I mean, you could go for a session, try and figure it out, and she'll probably know, then be able to sort it out yourself. You know, and then it's like, you're only going for one session. It's a problem, like, especially for a slightly older generation where there might be a little bit more stigma around it. You're literally going in to shoot the shit, see how you're getting on, see what the problems are. The clinician gives you a list of problems in inverted commas, and you come away being like, yeah, I know how to sort them. Actually, I'm grand. I don't need someone to talk to about that. But they can always dip back in if they want. Do you know what I mean? Like, I've met loads of parents who've been coaxed by children, not children now, sorry, by the parents' children, if you know what I mean, like they're older adults or whatever. And a lot of them will have sent them podcasts that I've done or different things, or they sent them mental health podcasts in general and be like, look, this fella's in Castleknock, there's ages of waiting list, or whatever they might say. And then it's kind of like, oh yeah, okay, the waiting list is 6 weeks anyway. So actually I don't have to commit to this right now. I can flirt with the idea of it.
Yeah.
And then you can kind of follow up. Oh, how you probably have that appointment coming up, do you? Yeah, I'm still thinking about it. Well, has things changed? No. Then what have you got to lose?
Yeah.
That's how I would approach trying to do it, because you don't want to manipulate or strong arm someone in, because I meet plenty of teens and adults who are there and it's like, I'm here because my wife is making me go.
Yeah.
And I'm kind of like, well, sure, like you might as well.
There's no point. Yeah.
You might as well just leave.
Yeah.
It's court ordered, or I'm here because my mom wants me to be here. Like that's classic teenagers. And with teenagers, you can work with that because their mom is making them come back.
Yeah.
Like they have to. Whereas with an adult where they're forced, it's like, if you don't really want to be here, what's the point? And then you might take that route of like, well, are you happy with the way things are? Like, we've got 50 minutes. We might as well chat about it. And then you can head off and never come back if you want. And then people feel like, okay, I have an out and it's not a big thing if I leave. And then you can ask them about the problems that they're having. And they might say, actually, I'm fighting with my husband a lot more than I used to. Oh, right, okay. And, you go through a list of problems. You might say, okay, well, I just noticed like you're kind of, if you don't want me saying you're in your 50s, it might be kind of perimenopausal. Have you considered that it might be a hormonal element? Because I actually think that you're a really nice person. You seem to have gone through a lot of rapid changes recently. And there's been no life events that would indicate that. So could it be a hormonal, or could it be a neurological? Like for some people, it could be a brain tumor or different things. It's brought on a rapid onset change in personality. So it's about kind of saying to them, it could be a medical issue. Maybe you don't need to come back to me. Why don't you go rule out all the medical issues? And if it's none of them, then maybe you come back to me. We can have a bit of a chat.
Yeah.
And then people are like, okay, I've got something to actively go at here.
Yeah.
Yeah. But if someone has a really rapid personality change at that kind of age, you'd be thinking it is probably perimenopause or menopause, or else there's, we've had patients in the past where they've come to us and it's like, I think you should actually go get an MRI, and they've actually had a brain tumor or different things. You know what I mean? So like, yeah, it can happen to people, because that's obviously what brings on those changes. Like, so, it's good for people to be aware of these things.
Yeah.
So
Yeah, that makes sense. I'm watching an awful lot of Grey's Anatomy lately. You're dead right.
there you go. Yeah.
Jen's like, I've
Cured,
Dr.
sorted.
Shepherd would agree with you, Conal.
one more, and then we'll let you go home.
Yeah, take your time.
Dead of the night. We'll be here at midnight, being like, and then what else happened?
We can't
Tell us your worst story.
Like,
yeah. But a lot of people asking about grief, and I suppose they've tried counselling.
Yeah.
And they're like, when do I know? And I'm like, obviously, grief is such a personal journey, and everybody takes it differently, and everybody processes it differently. And it's like, when to pursue maybe a different kind of therapy or CBT, or when would that be, or what would be, I suppose, their indicators or their guidelines when they feel like they're just not coping, particularly in any way, shape, or form. They don't feel like they're further along than maybe 6 months or a year or even 5 years.
Yeah, so I mean, people grieve differently, and there's no fixed point in time at which point it's a massive problem. I suppose that it depends on how much the grief is impacting the quality of your life. So if you lose someone that's very close to you, like, you might grieve them for the rest of your life, and like, that's okay. That's very normal, because it's it's a huge loss to people, and they've obviously loved them and they've invested a lot in them. And I'd be heartbroken to think if anything happened to my family or partner or anything. So I think though there comes a point where the grief is actively having a depressive mood effect on them, in which case maybe that person hasn't processed that grief in the healthiest of ways, and they might see themselves as not really able to exist without that person. So it's about trying to develop that person's sense of self and boost their self-esteem. So it's like, well, is life worth living actually without this person? And if it's not right now, what would need to happen in your life for life to be worth living, for life to be enjoyable again? Like, what would that look like? And help people do visualization exercises and imagery work and compassion focused work to try and see themselves as someone that's actually worthy of feeling good again. Because for a lot of people, there's a slight secondary gain in feeling bad, and that, like, if I feel good, it means I'm not grieving them. So I shouldn't feel good. So it's good to maintain this kind of grief state. Like, think how would that person want you to live your life? Would they be happy if they came back to life and they saw that's how you've been living? No, they want me to be happy. Okay, well, what would that look like? And if you turn around and go, no, they want me to be miserable. Okay, well,
what were they to you?
Who was this person?
Who was this monster? You know, so it's about kind of helping people to recognize that, like, grief is very normal and it's very painful, but it doesn't necessarily have to stop you dead in your own life. And grief can be about celebrating the life of someone rather than grieving the loss of them as well. And so it's about trying to think about how do you put your best foot forward, moving in that direction. But just for people listening, like, it's very difficult, you know, but there's no fixed time for it. Like, it's a really sad thing to have to experience, you know. And even talking about it, I'm sure you can probably feel a little bit choked up, you know, probably losing someone close to you. That's normal. Like, it's okay to be upset. It's okay to be anxious, to be grieving, to feel a bit low. But if it's really impacting you day to day and grief counselling hasn't worked, that process facilitated space, then it might be worth going to see someone a little bit more specialist to try and get a bit more out of it, you know.
You just basically, I feel like it sounds so simple. Do you know what I mean? Like the CBT, not that it is simple because it's not, it's specialist, like, obviously, but just, I'd be kind of going, why would you go on to counselling? Just go straight to going,
Yeah.
do you know what I mean? That kind
CBT
of thing,
Solutions
like,
in Castleknock Village.
yeah, exactly.
Thank you.
It's just such a good service, even if, like, you just need to check in with yourself, kind of thing. But
Yeah.
with the waiting list.
And I suppose that, like, you know, the purpose of therapy, and people are often kind of like laughing and say, like, we have a really unusual business model in that we try to push people away from us when they're coming to therapy, because the goal is to make me redundant. Do you know what I mean?
Yeah.
Like, we want to turn people into their own therapists so they can practice the skills on themselves, their families, their children. They have legacy impacts and stuff like that. And so there's some people that might come and see me for 20 sessions, 30 sessions, less, more, depending. And then I might say, look, do you want to just meet once a month for a little while, phase it out, then meet once every 3 months for a little while. And then, like, if things flare up, because, like, that's just how life is, they can come back and try and work on enhancing those skills a little bit further. For a lot of people, they go to therapy, they learn the skills, they improve their life, but they're stuck in the same situation. So it's like kind of giving therapy, you know, to someone in prison, you know, where they're like trying to be assertive and confident and stuff, but, like, it's a really violent environment. Do you know what I mean? And there's a real threat there. So it's like, no matter how much skill or capacity you have, it's very easy to revert to type. And that's why it's really important for people to change their circles as well, like develop hobbies, develop interests, develop friend networks, and surround yourself with people who, you know, are genuinely interested in you and you doing well. And, you know, I'm sure everyone can probably relate to the table here. Well, you know, as you get older, it becomes a little bit more lonely. And so people are more keen to cling on to their friends. But it's about kind of saying, well, you know, like, are those friends the best for you? Like, they might be friends for a pint or friends for this or friends for that, but, like, are they people you can actually go to? I'm very fortunate. I've got 2 or 3 really close friends that I can go to if I was really upset about something. I can talk to them about it and say, listen, I feel shit.
Yeah.
And they go, that's all right.
Yeah.
Do you want to, you know, go for a game of golf, or do you want to do something? We can have a bit of a chin wag as we kind of do this activity. It's like, yeah, actually, that'd be nice. Do you know what I mean? Or you might just go and sit in the cinema and not talk. And sometimes that's enough for people. Do you know what I mean?
Just companionship.
But it's just about having someone there to know I'm not on my own here. You know, and that's really important for people to recognize that as a process. Like, even sorry, I'm conscious I don't take up too much of your time.
No, go.
Sorry,
I'm like, please finish your thoughts.
I'm free for ages. But, like, even on that people pleasing side of things, you know, like, a lot of people that come to us for kind of those really strong people pleasing tendencies, like, if you imagine you've got a people pleaser at one end and a narcissist at the other, like, a narcissist might have people who are too afraid to leave them because they're vindictive and cruel. People pleasers have people around them because they're super convenient to be around. Like, they're the good time friend who's always up for it, you know. So I text you, do you want to go to cinema at 10 a.m. on Sunday? Yeah, great. But then it's important for that person to recognize, like, you have people around you because you might be convenient, and you can be a really nice person too, but in the middle between people pleaser and narcissist is assertive. And forgetting people, like, because the people who are around you here in the middle are people that actually want to be around you because they respect this as a quid pro quo. So, for example, like, if you, the house painting, to go back to that, like, if I'm a people pleaser, you're going to text me because you know I'm not going to say no.
Yeah.
But then I'm like, oh, do you want to go for a few beers or do something afterwards? You're like, nah, not really. Because, like, I'm convenient for you. Do you know what I mean? So I'm like, okay, well, maybe I need to chop you then if that's the case, if it's never reciprocated.
Yeah.
Do you know? And that's really important for people to recognize, that transitioning away from people pleaser can sometimes mean losing those people who are kind of around you for convenience.
Yeah.
And that's
hard.
That's really hard.
Yeah.
Like that's so hard.
Yeah. Especially with childhood friends. I feel like a lot of people are like, I've known them since I was 5. I'm like, but they're a dickhead.
Yeah.
So like, they were probably a dickhead at 5. They're a dickhead at 35. I don't know what else to tell you. And it's hard, like, trying to have that rationale with someone, because I feel like, again, we put a lot of, same with relationships. It's like, but I've been with them for this amount of time. That means nothing if you're not happy.
Yeah.
Like, that means literally
Put a
nothing.
lot of weight into the amount of time that we invest in people, don't we?
Yeah. That's a quantity over quality argument, though, isn't it? Like, whereas, like, and that's okay for a lot of people to be in those relationships because they can change to maximize those relationships. And just because someone looks after their own needs doesn't mean they can't meet the needs of others as well. And to recognize it's a balancing act. Like, you don't have to be taking from people for you to gain. Like, it's not a zero-sum game where it's a trade-off. Like, everybody can win, and that's what a good relationship is. That when you meet up with your friends, it's nice to, to recognize that.
Yeah.
Yeah. So interesting.
It's so, we'd have you here all night.
I know.
So
I'm like, I've got 35 more questions, but yeah, we'll leave it there.
Oh, actually, the addiction question. There was a.
Yeah, I think.
I have time if you want to ask.
Yeah.
If you want to ask.
Well,
Perfect.
it does. Is CBT, because obviously, so the question was more so around, like, they were thinking about attending NA. They didn't really know where to start.
Yeah.
Basically,
Yeah.
their partner, they found out recently that they were an addict, so it was just a kind of what route to take. And obviously, you were coming on. So, would CBT be a good tool to tackle addiction, or
For the person, the drug user,
for
or
the
the
drug
partner?
user? Yeah.
Well,
both.
I suppose
Yeah,
to try and,
suppose.
like, I think the partner was asking that question. It's like, number one, how do you approach it? Number two, would CBT be the right thing? They don't want to do AA. And I think, again, AA has, like, that's probably a stereotype, or not a stereotype,
A very cliche way of approaching it, or
not even that. I mean, there's a lot of, like, there's AA, I think, is the number one thing that everybody thinks, isn't it? It's like, maybe you should go to an AA meeting. And it's
Yeah.
like on an American sitcom or something. You're like, that's like not the be all and the end all. So I think the approach was like, is there a way of, again, almost like the parent situation,
There is, yeah. So the first thing I say to you is that if there's any, like, really pressing questions, I'm happy to answer them. There's no rush me, right? So the second thing, so on the addiction side of things, like, cognitive behavioral therapy has been tried and tested in addiction. It does work for people. Okay. One of the big problems in addiction is pain and trauma. And people have learned over time that, so they might have negative thoughts in their head, they start feeling negative emotions, they get negative body sensations, they do a bump of cocaine, or they smoke a joint, or they, shoot heroin, or whatever it might be. And in that moment, they get this massive relief and they go, oh, geez, I feel better, which reinforces, that's a great idea, kind of keep doing that. But then long term, they're in bits the next day, or, they spent all their money or whatever it might be, which reinforces those negative thoughts, negative emotions enforced, body sensations, more drive to take drugs, temporary reinforcement, relief, back up to the... and so you end up in this kind of cycle. Yeah. CBT is very helpful for helping people to identify that cycle. With people in addictions, they tend to be quite depressive and have high rates of anxiety. CBT can be quite good at treating that. But I will only see people with addictions if they're actively making a commitment to stop using.
Okay.
And so the success is measured on the amount that they use as well. So when I see people, I'm like, okay, well, how many joints a day are you smoking now? And, people who are like, oh, I'm smoking about 15 joints a day. Grand. Okay, well, how many joints do you want to be smoking a day? Because your risk of, drug-induced psychosis is extremely high. And then I say, I'd be happy smoking one a day. I say, right, okay, well, let's try and get down to one a day, and then I'll discharge you. Okay. So you work with them on certain skills. So what's it like now that you're not smoking a joint? Geez, I feel really anxious. Great. How do we work through this anxiety? Well, actually, I'm thinking about, this time when I saw my dad physically assault my mom, and it's bringing up lots of memories, and I feel really distressed. Great. Let's work with those memories. Let's try and repair the trauma. Let's try and rebuild your self-esteem. And so then you meet them the next week, and they're like, God, you know what? Actually, I only had 12 joints a day. And people are like, Jesus, 12 joints a day is outrageous. For that person, that's a huge reduction. Do you know, that's 20% reduction in joints.
Yeah.
And so if you can do that week on week, after about 5, 6, 7, 8 weeks, that person's kind of, maybe down to that one joint a day.
Yeah.
And they have the skills to practice. So when they feel distressed and the urge for a joint is there, they're like, no, actually, I know what's going on here. I can identify the cycle. I can actually challenge these thoughts. I can deal with these emotions. Okay, this is pretty shit, but I'm not going to have the joint, and I'm going to put off the joint for an hour.
Yeah.
I'm going to practice these skills. And if I still want the joint after an hour, grand. most people by that time are like, do you know what, actually, I'm in a much
I'll
clearer
go another,
headspace.
yeah.
I can go another hour.
Yeah.
And so like you measure it on the frequency, intensity, and rate. So how long you smoking joints for, how intense is the high when you get it, and how frequently you're doing it. And you try and get reductions in those 3 brackets and help people move on. Whereas a lot of people are kind of go with the abstinence model, which is like you don't do any drugs at all. I have mixed feelings about that. I think it works really well for some people. For some people, it doesn't. I think that when people have an active cocaine or heroin use, abstinence is absolutely the play.
Yeah.
I think cannabis is a slightly different story.
Yeah.
It's a bit more of a psychological dependency than a physical one. But people do get cravings, especially if they mix tobacco in with their joints or whatever. So
I was going to ask you, does it work for like smoking cigarettes? Because obviously the receptors in your brain come into play there, and
they do. Like, I mean, you need to, like, I mean, if you smoke cigarettes, you should vape, and if you vape, you shouldn't vape at all. Do you know that kind of way? Like, that's the rule. But like, so you'd always, like, in most hospitals, if people are smoking, you kind of encourage them maybe try vape. Yeah. And then you try and reduce your vape use over time and stuff like that, because obviously it's a lot less harmful at the moment with the studies we have. But it can work with cigarettes, but there needs to be a commitment. There needs to be a buy-in. Like with cigarettes, like there's an active addiction. So, but like, what's fueling it? Like, what's underlying the addiction? So I'm obviously coming this from a very psychological model. The medical model might say something completely different altogether, you know. But I've had quite a few clients now who would have came to me and they're smoking, and they're like, I just noticed the smell of smoke when you come in. Like, how do you find that? And they're like, spending a fortune on it.
Yeah.
All right, okay. And like
how much money do you want to spend on that?
Yeah. You know, like I have people, and you know, our sessions, to be completely upfront, they're €140. I have people who are smoking 7 or 8 boxes of cigarettes a week.
Like I just think, like, again, it's crazy. Some things this country are pricing you out of your addiction.
You know, but they are, like, it's the same with the minimal pricing for alcohol. But it's the same, like, but people are like, oh, do you know what? I'm happy smoking the 7 or 8 boxes of cigarettes. It's like, do you know, if you just didn't smoke for 10 weeks, you could do 10 sessions of therapy and you might not actually need to smoke. Do you know what I mean?
Yeah.
And then the savings you make after that are substantial.
Yeah.
Like the cost savings of successful therapy for economically per person is huge. Like, that's why the model improved access to psychological therapies in the UK was rolled out.
Yeah.
Layard and Clark rolled it out in 2007, and they reckon that if you can kind of reduce people's depressive or anxious symptoms, they engage better at work, they're far more likely to get promoted, they're far more likely to transition into higher paying jobs. Because mental health problems, it's a little bit like playing a video game on hard. And if someone's able to tolerate their mental health problems and tolerate the stress, it's like having a cheat code. Like, you kind of get through life an awful lot easier because you're a lot more confident, you're a lot more forward, assertive, and you're more likely to value yourself and see yourself as worthy of getting those jobs and putting yourself in positions where that's a big sacrifice, it's a big time commitment, but I can do it. I'm worth this. Do you know what I mean? So it's there's a huge knock-on effects for people economically long term as well. So we do a lot of that as well in CBT solutions, about like, are you happy in your career, and if you're not, where would you like to go, and what are the steps to get there? And people are like, Jesus, actually I never even thought about this, you know. So
Jesus, it's so interesting, isn't it?
Yeah. Well, look, I think the biggest thing is like resource and actually people figuring out that, like, I think a lot of times when people think therapy, they're like, really expensive, don't even know where to start, don't even know, like, what if I don't like it, and then I'm back to, like, with a worse kind of, I suppose, perception of what it could have been to me. But I think, well, obviously we have a podcast where we talk about all these things all the time. I think it's really important. Like, obviously what you're doing is incredibly important and really well needed.
Thanks.
And it's great to see, considering where we were last time we had a conversation, it's amazing to see how much your business has kind of like come on and how much like things have changed. And yourself, like, you're a massive advocate for free, not free services, that's probably the wrong word to use, but I know when we spoke previously, you talked a lot about like what services can be given, where can you access, like, even if it's talks, if it's this, if any of that. If you want to speak to a little bit of like resource that you know are out there for people, maybe before they even take their step into actually paying for therapy, maybe for the first time, or even like financially like starting to like figure that one out.
Yeah, like, I think in terms of resources, it's really hard to answer that. Like, we have a blog on the website cbtsolutions.ie, and people can go on and look at certain things that come up in the blog, and they can read through and go, oh my God, I connect with this, or this makes sense. Or like, even some of the videos that I do on Instagram, like, I know they're not winning Oscars anytime soon, you know, but
like, look at it. definitely like not help. Well, it helped me in a way that I was like, wow, I definitely have these passive aggressive tendencies sometimes, and these little things that it made me think. So that is, I definitely think like, I think social media is one of the best free resources that we have.
Absolutely.
I know it can be troublesome when you look at the far right, but like it can definitely add to a lot of people's knowledge.
Like when I do those posts, the idea is that like you might get one or two people that kind of click with that and go, geez, I'm doing that. That's actually enough of a problem for me to want to get a bit of help to do that, you know. And like most people you speak to, like they'd be very happy to drop like $2,000 on a holiday, no bother, for a week somewhere. Do you know what I mean? And you're kind of like, well, you know, if you use that $2,000, actually, you could get quite a lot of therapy out of it and come out the other side much stronger and much happier and confident, fulfilled in yourself and doing what you actually want to do. Like you might have to forego the holiday or whatever it is, but like, you know, we all have to cut our cloth to measure and make sacrifices, you know, and
feeling like you had a holiday.
A holiday will make you happy for a week.
Absolutely. And like, you know, one of the things that people often say is like, you know, like with therapy, it's expensive, and you know, good anything is expensive. Like when I go see, you know, my consultant in Vincent's, it's €145, and I'd say my bum barely kisses the seat before I'm back up and out the door. You know, I get about 2 to 3 minutes in there. But I'm not paying for the time, I'm paying for the expertise, because I don't want to go to someone who's not going to understand and treat me really well. And that's the same attitude I have even when I had my own personal therapy as part of my training. I want to go to whoever I thought was the best at the time, and I was happy to make the investment. You know, so I think it's, you know, it's needs for different people. And one thing that we are developing, because I am conscious that the cost of therapy can be high for people, is we're looking at a 5 to 6 week online seminar of CBT skills training. So it might be €150 for the 5 weeks, and people log on and they've complete anonymity. They can turn off their cameras, turn off their mics. They don't have to be seen, heard, anything. And I go through, say like, this is the CBT model, here's plugging it in. And someone in the audience might go, actually, can you do that for me? And I'll do that out on screen, and people are like, oh my God, that actually makes sense. And they take that and they take a certain batch of skills. They practice that in between week 1 and 2, and then in week 2 we're moving on to a new set of skills. So we're
When
looking
you
at
say
doing
skills,
that.
you're talking about tools for their own problems.
Yeah, so like one of the kind of key tools in cognitive behavioral therapy is what's called cognitive restructuring. So like you take someone who's okay, so take me coming to the podcast tonight, and let's say that my mood was a bit low. I might say, oh God, the girls aren't going to like me. I'll say something stupid. I'll make mistakes. People think I'm embarrassing. My practice will collapse. You know, people will think I'm not good enough, right? And I'll take those thoughts and say, well, okay, well, you know, I'll say something stupid. It goes, well, when's the last time that happened? Well, it actually hasn't ever happened to me. I've never said something too stupid. Okay, so how likely is that to happen? Not that likely. Okay, how likely is it your practice will fall apart because you said one silly thing anyway? Not very likely. Okay, well, if you heard a clinician and 90% of what they said was good and 10% was waffle, would you be inclined to see them? Yeah, actually 90% is pretty good. I would be. Okay, well, how are you feeling after thinking like that? I feel a lot more balanced actually, because I'm able to challenge those thoughts out a little bit. So you give people those skills, you know, like, oh, that's not going to work out. Okay, well, I'm going to make a mistake. Well, of course you'll make a mistake. It's your first time doing something. Like I remember the first time I did the podcast with you guys, I was like, you know, oh God, I really hope this goes well, you know, because like obviously I'm an ambassador for CBT solutions, you know what I mean? So like I'm conscious of the pressure on that, but I'm also kind of thinking, well, if I'm listening to a podcast and someone trips over their words, I don't judge them or sneer them or whatever. So why would people do that to me? So that's the kind of cognitive skills to help people restructure the way they think, which then leads to them feeling a little bit less anxious. And it might only reduce the anxiety from a 6 to a 4, but it's much easier to operate at a 4 because as anxiety goes up, thinking goes down. Yeah. That's the way to kind of view it.
And it's that a lot of people spiral so quickly and they catastrophize, and like it one little thought can just...
I never actually thought of that, of like, as anxiety goes up, critical thinking goes far down.
Massively.
I don't know why you're like you think, I think of like anxiety being like, I'm unfortunately I'm at 100% of everything right now. That's the problem.
So the way thinking about anxiety and how it impacts critical thinking is that, like, if I put 10 words on a page in front of you and I said, listen, take your time, I'm going to ask you to recite what the 10 words are. If you get them wrong, don't worry about it. You'd be like, grand. You'd probably get like 6 or 7 words. If I put the same sheet of paper down in front of you and I put a gun to your head and I said, if you get these wrong, I'm going to kill you and your family, you'd be so anxious. You'd be so anxious. You wouldn't even get one word because you're in survival mode. And for people with real anxiety, that's what it is. Like, they are literally just, I need to get through this as quickly as I can. So they're not taking things in. So the world is moving much faster. So then they feel more out of control. And like the 3 core tenets of generalized anxiety disorder are poor problem orientation, which is obviously a huge one, intolerance of uncertainty, and unhelpful self-representation. So a lot of people with generalized anxiety sort of see themselves as weak or unable, right? So when they have a poor problem orientation, they can't identify what the problem is. Because they can't identify it, it activates the intolerance of uncertainty. So like, oh God, I don't know what the problem is. I'm getting really uncertain. And then they see themselves as weak, so they can't solve the problem, which all three then kind of coalesce to make them feel super anxious about what's going on. So that's where CBT comes in, to break things down and help people understand their experience.
It is, yeah. You can kind of see the pattern of like how you get people to think like critically about.
But then I also hear like a lot of people saying, well, I've high functioning anxiety. And I'm like, what does that mean? I'm like,
Probably not
pop
much.
off queen.
Probably not much. Like, I mean, the term high functioning is just like something that like, people like to say. Do you know what I mean?
It means that they can leave the house.
I was about to say, is it like a push through situation?
Yeah.
Like,
I don't know. 'Cause
Yeah,
I
don't know, because that's not something I use.
I've never heard of it. Like, I think that you can function with a level of anxiety, but I suppose the type of anxiety I'm talking about is a clinical level of anxiety where it's directly impacting people's social life, romantic life, personal life in multiple domains, where they're like, oh God, like this is actually a tough way to live. And for some people that's a 4 out of 10, for some people it's a 7 out of 10, but then I meet people who have maybe 2 or 3 panic attacks every day, you know what I mean? So it's a complete spectrum. But like if you've only ever had a 5 out of 10 level of anxiety, a 6 out of 10 is really bad. Whereas if you've had a 10 out of 10, then a 7's pretty okay actually. Do you know what I mean? Because it's all relative, isn't it? You know? And it's the same for, say, like, you know, even take that kind of relativism there. Like, you take people who grow up in houses where parents are super critical, they're far more likely to tolerate a critical partner.
Okay.
Because if I'm your dad and I grow up and I'm like, oh, you stupid so-and-so, and you gobshite, and you'll never get that right, and you'll never do anything right. Well, then when you meet a partner and he speaks to you like that, you don't like it, but it feels familiar.
Yeah.
So it's what you know versus what you feel. And there's a disconnect. So Eugene Gendlin is the philosopher to come up with this idea of what you know and feel. So like, you might kind of go, God, that's not right for him to speak to me like that, but it kind of feels kind of normal. That's familiar. Do you know what I mean? It's like a family feel to it.
Yeah.
So you'll have a much higher capacity to tolerate that. Whereas, say, if you grow up and your parents are like, listen, you're great, you can do whatever you want to do in your life. Don't ever let people speak to you badly. And then I come along and I'm speaking to you badly. You're like, I'm not tolerating that. That's absolutely not okay. Because it's perspective, it's what you know growing up, and that's the template people carry forward. So like everything's on a spectrum, but everything's relative to what you experience too. So it's really important for people to recognize that.
So why people say you end up with people like your dad?
Absolutely.
Yeah.
Because it's familiar. Like there's an inescapableness to it for some people. And then they're in a relationship like, God, this is really not good. But like that man probably grew up watching his dad speak to his mother like that. So he's like, yeah, this is how you treat women. And that woman has grown up a girl experiencing that from her dad. And she's like, yeah, that's how men speak to women. So it's a perfectly compatible piece for them. It's dysfunctional. But it works for them for a very short period of time, until someone just becomes so unhappy in the relationship, or they lose complete respect and faith in that person, the relationship breaks down. But the problem with relationships is that people trust their gut on things, but their gut might not necessarily be the best thing to trust on things. You know, you need to look at what the evidence is, and if the person you're with, if their words and actions aren't matching up, time to maybe reconsider, because everybody can, like, talk is super cheap. Like, I can say, listen, I'll be there for you if you need it, and then you're like, listen, give me a hand painting the house. I'm not doing that. You know, it's like, well, but you said you would.
I'm literally never getting you over to paint. Like, what's going on here? Like, you've told me 5 times now that you're not painting
People
with me.
People on the podcast can't see you in the painter overalls right now.
Like, look over to the corner. There's a box of paint. You're
Plenty of Dulux in the corner.
He's lovely and tall. Like, that was the whole gig. Like, I brought you here to help me paint. Right? One day. One day I'll
left
get
the
you
chat.
Yeah, exactly.
Well, no, that would be really I'd actually be really interested in doing that seminar if you were going to.
Yeah, we're looking at trying to roll that out probably towards kind of October, November.
Right.
One of the things about running that is that there has to be a certain number of people to do it to make it
Worth it.
worth it, actually. Because like obviously you kind of want 20 people to chip into that, or 15 or whatever, and then people are like, oh, actually I'm getting something from this. Because if one person shows up,
extensive amount of work, like.
Oh yeah, like I mean, each hour that we would deliver would take maybe 5 or 6 hours to develop that hour. Do you know what I mean? So,
Yeah, but like you say, you're not paying for the hour. Like
No, you're paying for the experience.
Yeah.
I mean,
Yeah.
it's
We've said that many a time
Yeah.
on this. You're not paying your nail tech for
Yeah.
your nails getting done in 30 minutes. You're paying for the 10 years to learn how to do that.
Yeah, and if someone can do my nails in 5 seconds just as good as they can do in 30 minutes, I'm just as happy to pay the same price.
Oh,
It's
yeah.
the
Yeah.
same standard. You know what I
That's
mean?
what I
Yeah.
mean. It's like you're paying for the experience. You're not paying for the time it takes to perform that task. Thank you so much.
Thanks a million for
You've
having me.
been
Very
as usual, fab.
Yeah.
Thanks a
It's
million.
sorted a lot for us. Do you answer DMs is another thing that somebody asked. A lot of people, they're like, does he answer DMs? I was like, this, okay.
So I do answer DMs if they're not asking me anything too clinical, because
Yeah.
I don't give clinical advice.
Yes.
If people are asking about something specific, or if they're asking about a disorder or something like that, if I have time, I will absolutely answer the DM.
Yeah.
The difficulty is that I would say to people is that because it's a, like, same for you guys, it's like a business Instagram account.
Yeah,
like
yeah.
they go into requests.
Yeah.
So I have to remember to actually click requests. So
Yeah,
like the
yeah.
last time I clicked requests, I think there was like 19 requests. And a lot of it was just asking about therapy and where
Yeah.
can they go
Yeah.
and stuff. So, and like, that's why on the Instagram, if people are thinking about actually doing therapy online or face-to-face or ADHD assessments, cbtsolutions.ie, just click that link.
Yeah.
But yeah, I'm happy to answer certain DMs, but there's certain ones that probably won't be able to answer, but I'll tell people that if I
Yeah.
feel it's
Yeah,
not
yeah.
appropriate.
I think that was more like,
Like you're
Can
not
I
going to
approach him?
diagnose
Yeah,
somebody.
exactly.
What time
yeah.
is it?
yeah.
You're not going to diagnose somebody over a DM,
Yeah.
but you
No,
can give them
absolutely not.
information on
Yeah,
assessments.
where to go or whatever.
Yeah.
Yeah, absolutely. Yeah.
So you're doing a lot more videos on your social media right now. So
Trying to.
definitely get in front there. He's got the captions app. He's using it. Okay, so you can read along if you're in work. But thank you so much for coming on. Any more more links or anywhere else that you want to direct us to? So we've got cbtsolutions.ie
Yeah.
and we have cognitive_Conal.
Yeah.
Yeah.
And yeah,
They're my
They're
two
your
things.
two
And I think just for people to be very clear that at the moment we provide ADHD assessments for children, teens and adults, and psychotherapy for teens and adults.
Okay.
And that can be online. For teens, probably prefer face-to-face, to be
Okay.
honest. But for adults, online and face-to-face is available if people are interested.
amazing.
Brilliant. That's
Right.
It's great. Thanks a million.
Thanks for having me.
That was Conal.
Yes.
Again, we will put everything down in the description below if you want to click on those links. You are free to do so. That was so enjoyable.
We are giving you the power.
Yeah.
Yeah.
That was so enjoyable.
Oh, he's an angel.
I
Yeah.
think we should just have him in once a month just for our own sakes.
Us again.
Yeah. Hi.
Hi.
How's it
I have
going?
I have some problems and I got to talk to you about them.
And obviously, like we do want, I think he will be our resident cognitive behavioural therapist.
There you
So if you ever have any questions for him, obviously you can send them to the Instagram, or if it's not too urgent or anything like that, if you ever think of anything, send us a DM and we'll put them on a list for the next time that he is in, because that definitely won't be the last time. Jenna,
Absolutely.
we have to do our few little any other businesses before we go. So Carla, have you got an unpopular opinion anyway?
People who go out on the Sunday of a bank holiday, you need to get your head checked. Okay? That's what I'm saying there. That's all I have to say.
Okay.
I don't even want to talk about it anymore. Imagine going out on
I'm trying I have
Sunday.
questions.
a Sunday of a bank holiday. So you mean to tell me you had Friday night, you had Saturday night, and you chose Sunday night, and you're going to be all over the shop on Monday, you're back to work on Tuesday?
Very disorientating.
Sounds silly. It's giving silly Billy.
It's the way that it always has been, though. It's
But
generational trauma.
that's so ridiculous. Like,
Oh no, it's so
break the
fucking
cycle.
stupid.
I'm
Yeah,
asking you to break the cycle.
that's a behavior we need to unlearn.
I'm asking you to go to
do you know-
cbtsolutions.ie and break the cycle, okay?
We did that for FRAC there a while ago, and I fucking hate it.
Uh,
I love the event. The event, it was a great night,
in bits.
but the fact that it was a Sunday night,
In bits.
the
Like.
anxiety.
Yeah, that's what I mean. Like, Monday, all you're going to be
Do you
doing is
remember
running around trying to find his annex. Like,
If
that's
I
not on me.
fucking scroll through them voice notes, like the voice notes I sent you the next day,
You were off the charts.
I needed to stage
Deserved.
the gaff. Like, I was just...
Yeah, you were like, I don't know what's wrong with me. I was like, I
There
know
was
what's wrong
something in
with
the
you.
pints, I think I got
Yeah.
spiked.
She was like, those pints, there was just something. I was like, no, it's because you fucking skull back 8 of them. Like, that's probably
Sunday
what was
night.
wrong with you. You arrived to the place drunk. So I can only imagine what was going on before it. But like, yeah. So anyway, get your head checked. Give your head a wobble.
Oh, yeah, there's one coming up, isn't there?
The what?
A bank holiday. There's one coming up.
It's the August one, and yeah, it is. It's coming up. It's coming up strong, Jan. So I'm glad you brought it up because yeah, holy fuck,
Fucking
it's on its
Jesus.
way.
It's on its way. It's fast approaching. Have you got a stamper before we go?
I do indeed. Carla's Stomper of the Week. So this is Cruise by Roya, and they're like a TikTok duo,
Okay.
or they're like messing around in the studio, and they'll try and come up with ideas,
Right.
and they'll like riff off each other.
Okay.
So this song is Cruise, and it's such a good summer night cruising song, if you will. But again, that's what they were like. She was like, he just like started with a beat, and she was like, what am I going to do with this one?
Right, okay.
You know? But it's actually become a banger, and now I think it's gone like semi-viral.
Okay.
Like not the most viral thing in it. Anyway, here's Cruise.
It's very main character, isn't it?
Yeah, it's very like windswept.
With I like
Windows down.
in a convertible,
Yeah.
kind of with the drone camera pulling away as you drive down the highway,
the drone camera, yeah.
and
yeah.
it's then the end credits come
Yeah,
up.
end credits come up. Yeah, yeah.
It's
It's very that. But
I've come of
I quite
age.
enjoy their
I've done it.
profile. Quite enjoy their profile.
Right, lovely, very good, very good. Look, we hope you enjoyed. If you didn't, there's something wrong with you.
If you didn't go to cbtsolutions.ie.
No, it was such a good. If I do say so myself, that was such a good episode that we provided.
And also, very quickly, we still have some tickets available for our show. Yes,
Yeah.
our show is coming up, everyone. Get excited. It is the 22nd of August.
Yeah, 22nd of August, Laughter Lounge. It's
€25 ticket.
€25 ticket. We're gonna do a few little bits, few little extra bits. It's more than just a podcast.
Yeah.
It's more than just a
It's an
kitchen.
experience,
It's
so
an experience.
we'll see you there.
And all of our proceeds will be going to the people of Palestine.
Yes, indeed.
So it's a 2-for-1, realistically.
Mm-hmm.
We're going to leave you with a little snippet of our Patreon episode because there's a little reminder as well. Any other business, we're on Patreon. Link is down below as per usual. We're going to leave you with a little snippet which will be released the day after this is released. If you're listening in the future and there's no concept of date. We hope you enjoyed it and we talk to you next week. Bye.
Project 2025 is basically Trump's team came up with like their perfect plan from like day one of Trump's presidency. Okay. So here's the bullet points.
Here's what's going to happen.
Here's what's going to happen. Number one, put Medicare on a path to privatization. So essentially, no.
Who put Medicare? That wasn't Obama. Who was that?
No, that was Obamacare.
Well, yeah, who put Medicare in place?
Can't remember. But anyway,
It was a step forward anyway.
so they're literally like, if you are poor, die.
Fuck off.
Die.
Fuck
if
off
you are
and
poor, fuck off and die. Okay?
Jesus.
Medicare is Biden, I'm pretty sure. Because in point number 2,
Yeah.
get ready.
Okay.
Repeal President Biden's Medicare drug price negotiation program. Do you remember that one where he basically was like, no, we're not going to make it like $2,500 for every fucking ibuprofen you
Yeah.
take. Yeah.
Yeah.
They're like, no to that. Yeah. Oh. Number 3, threaten Medicare coverage for hundreds and thousands of Americans. Threaten is, so what they want to do is they want to any employer that has like any kind of like not
Policy in place.
prenatal and all that kind of support, anything to do with abortion that in any way, shape or form could give you some kind of cover if you in any way like could get an abortion. Like they're literally like hilarious, you're gone, like they will. Yeah, so there you go, love that. Reverse the Biden administration student debt relief efforts. Yeah, this is number 4, Jen.
Why
It's
the
19.
fuck
It's
are
19.
people supporting this fella?
Yeah, there you go.
He's like Lucifer.